Hey guys, thanks for doing this simulation to show the checklist and how it's supposed to work here for us today. So your next patient's going to be a 20-year-old male who's 70 kilos by predicted and ideal, and actual body weight, everything's all the same. He's a polypharmacy overdose. He's altered with a GCS of 6, has some snoring rests. You guys have determined that you need to intubate him because of A, airway protection, D, disability, expected clinical course, length of your flight, etc. You can assume that you've done the rest of your assessment on him, a full head to toe, and there's nothing else, no other concerns have been found, specifically no signs that he overdosed and fell down the stairs or had trauma or anything else of the sort. There's also been a blood gas which shows normal pH, normal electrolytes including his potassium. He's got 2 intravenous's in that are functioning well, 18s in each one of these ACs. And with respect to the airway, he doesn't have any predictors of difficult anatomy or physiology. The snoring rests were probably just because of his airway position. He's got essentially normal hemodynamics right now with a temperature of 37.4, blood pressure 104, rest rate of 20, blood pressure 108 on 74, oxygen saturations of 99% on the non-rebreather that he's got on there, and his blood glucose is 6.9. And if you have any questions that come up during the course, I'll try and answer them, but it should be fairly straightforward.
Okay, super. And electrolytes were normal, I think you said before.
Yeah.
Potassium was
Potassium's normal, electrolytes are normal, doesn't have a big in on gas.
Okay, great. Okay, Scotty, I'll get some drugs drawn up.
Okay, I'll start getting all the airway stuff all ready here.
Okay.
And, to get ready to intubate. Get the monitor turned on.
That's too bad the air cross out. CMAC would be nice to have, but that's the way it goes, eh?
It's all good. You said he still has snoring rests?
Still has snoring rests, yeah.
Okay, will he accept these MPAs?
He does.
Okay, so I'm going to put those MPAs in.
That seems to quiet down the snoring.
If I go to put in the OPAs, will he gag?
No, it does not gag with the
OPA.
OPA, accepts it quite nicely.
Okay, so I'll end up putting the OPA in as well.
What can I do there, partner? My drugs are ready to go.
Okay, if you want to get the monitor and the end title and get the bagger ready, that would be great.
You betcha.
With those NPAs, OPAs in, you don't hear any more snoring.
No more snoring? Okay, and the sats are still 99?
Sats are 99. Yeah.
Perfect, thank you.
Okay, Scott, so everything's ready to go. You've got a bagger, your circuit, the end tidal CO2 is warmed up, ready to go.
Okay, can you check the test the suction then, please?
I sure can.
I've actually got it sitting right here.
Oh, super.
And then just turning it on.
Yeah.
Just making sure it works.
Yeah, it tests great.
Okay, thank you.
It's just underneath his shoulder.
Okay, good.
And, just turned on his non-rebreather there.
Can you get the bougie there for me too, just because you're right
I sure
there?
can. She's there.
Thank you.
Do you want me to throw some nasal prongs on this guy as well?
Yeah, yeah, that would be, actually it's in behind me. If you want to actually test the cup, that would be
Okay,
great.
I'd love to.
Just so we're not crossing over one another.
Great. And I'll just loop that cup up for you, that tube up for you. Okay, it's all lubed.
Thank you.
And my line's running well.
I'll get you that checklist.
Oh,
there.
super, yeah. Yeah, these checklists are great, hey?
Yeah, it sure helps a lot.
Yeah, you know, it'd be great if we had another party, we definitely have them reading this off, but since there's just the 2 of us, we'll get through this, no problem.
All right, if you've got that stuff checked and whatnot, I think we're ready to go. Why don't we go through the airway checklist and then we'll get this guy intubated.
Okay, great. Okay, so patient positioned properly.
Patient is positioned properly.
Okay, nasal prongs 15 liters and NRB, BBM, PEEP valve.
They're on, and we've got the BBM and PEEP valve here for later.
Okay, O2, 2 sources on, sufficient amount.
Both sources are on and good amount.
Monitor on,
Monitor is on.
vital signs assessed.
Vital signs have been assessed.
IV functional,
IV is functional and running.
pre-treatment fluids, vasopressors, bicarb, atropine.
No atropine, no bicarb. Vasopressors aren't needed. He's got to have decent blood pressure, and we have the fluids going.
RSIP drugs, doses selected, contraindications discussed.
Okay, so you have that.
Yeah, so our plan is ketamine, standard dosing, 1.5 per kilo, no contraindications to succinylcholine, and I do have some drugs post-op we can discuss later,
Okay.
and I do have ephedrine should we need it.
Okay, sounds good.
PPE, gloves, mask, goggles.
Done.
BBM plus or minus PEEP valve,
It's right here.
OPA plus or minus MPA.
OPA and NPAs are both in.
Suction tested.
Suction has been tested.
Laryngoscope tested,
It
plus
has.
or minus CMAC on.
It is, yeah.
Endotracheal tube size, cuff tested, syringe on, lube, bougie plus or minus stylet.
There.
Backup Airways LMA King LT Crate Kit.
Okay, LMA is here, and the crate kit will grab out. We'll do an open crate, and it'll just sit on his belly.
Entitled CO2 initialized working.
Entitled CO2 is on.
ET tube holder.
The tube holder is here.
Sources of difficulty discussed.
So he is a predicted easy airway, and there's no physiologic predictors.
Assistant one brief regarding ELM suction bougie removal.
Okay, so you're going to be assistant one, so you're going to be helping with ELM when we go to intubate. If I leave the stylet in, you'll pull that out, otherwise you'll be assisting me with the bougie.
Okay, assistant two brief, spinal motion restriction collar open.
We don't need that because it's not indicated.
Assign someone to call out saturation thresholds for SpO2.
Okay, if you're able to do that, that would be great.
Okay, and what's your threshold for SpO2?
So as soon as we get down to 92, 93%, because he's 99 right now, then what we're going to do is we're going to stop our attempt, we'll bag him back up, and then we'll reattempt.
Okay, verbalize algorithm and plan ABC plus minus failed airway plan.
Okay, so airway is going to be just a direct laryngoscope with a Miller blade. I'm going to have a backup of a MAC in case that doesn't work. We also have a backup of our LMA, and we have our crate kit out and open, ready to go.
Post-intubation management discussed sedation. I do have my drugs as appropriate, all of the ones that I need, including rocuronium.
Okay.
Questions or concerns before proceeding?
I don't have any. Do you have any?
None.
Okay, then we'll go ahead and proceed.
Sounds great. So Scotty, it sounds like this guy does need to be intubated.
Right.
Are you good? I'll draw up some drugs. And,
Yeah.
maybe you and
James is actually going to help me here with
That's great.
getting some of the airway stuff.
Okay,
set up,
super.
So that'll be
I'm
great.
going to drop some drugs here then.
Hey there, James. Do you mind putting a nasal cannula on
Sure.
at 15, and we'll put that non-rebreather on at 15, and I'll get you to help me with some of the other things here when we're getting him ready to be intubated. Okay? Awesome. Appreciate that. Awesome, I appreciate that. Okay, can you test that suction there for me? And then I'll be getting some other things out here, and I'll probably get you to check my endotracheal tube too. I'll get that out there for you.
So Scotty, I've got my drugs drawn up. I'm just having a look. It looks like my IV's functioning
on
okay.
and tested underneath here on the right pillow.
Awesome, I appreciate that. Okay, here's the endotracheal tube. If you can actually just check that cuff, and then I want you to sit it right on his chest there, please.
What can I do to help you?
Bruce, can you get the BVM and get the put PEEP on that?
Sure.
And just make sure that that's all ready to
Yeah,
go.
sounds good.
Awesome, I appreciate that. Okay, he's getting, he'll accept an OPA. Yeah, he does. And I'm going to put in bilateral MPAs, checking his SATs, obviously, making sure he's still satting really well. Okay, he accepts all of that.
He does.
Okay, so we'll put that in. Okay, yeah, if you get the monitor on there too, James, with the end title and get it warmed up.
Sure.
We're going to put the crate kit just right there beside you. So it's going to be right beside you, James, in case we need it.
Sounds good.
Okay.
Can we hook this up to the DVM?
Yeah, actually, you know what, you can, and because it should fit with the mask there too. That way we have it, worst case scenario. Can you get it there, or do you want Bruce to help you? You got it?
Got it this way, right, Bruce?
Yeah, that can work. You betcha.
Awesome, I appreciate that. Bruce, you got all the drugs going up there?
I sure do, yeah. And you asked me to have the BVM ready. It's ready to go and the beat valves on.
Okay, yeah, James just added that circuit on there. So
Sure.
that's good. Okay, if we have the CMAC, we have the CMAC here. Other than that, I think we're ready to go there. You got all the drugs you said, right, Bruce?
Sure do.
Awesome. Well, we'll just get the OG out here. Put it right down there beside you where you're going to be at. Okay, so James, just while we're getting the rest of the stuff set up here, what I want you to do is you're going to be my assistant. So you're going to help me with the the stylet. To
Okay.
pull that, you're going to be holding ELM. So I'm going to have your fingers on his neck, and just right on the cricothyroid membrane or the thyroid cartilage. I'm going to have you put your fingers there, and I'll move your fingers if I need them moved. And then I also want you to be calling out the oxygen saturations too. So you're going to have to kind of turn sideways, yeah, or wherever you can see the monitor
I
best.
can see that monitor
Okay,
over there.
perfect. And then if I need the bougie, I'll have you help me with the bougie as well, and then you'll help the cuff.
Okay.
Okay, and you did test the cuff, right?
I did test it and
Awesome.
I moved it, yeah.
Awesome, that's perfect, thank you. Okay, Bruce,
Good
whenever you're
to
ready.
go for the
Yeah,
checklist?
let's go ahead with the
Oh,
checklist.
hi there. Is it John?
That's John.
Oh, hi, John. Do you mind doing us a favor?
Sure. Well, I'm
We're
just a nursing attendant, but...
Oh, no, John, you're very important in this whole thing. We're just going to get you to do a checklist here, and what I want you to do is actually read out the whole checklist, and just read the whole words per the line, and just wait for one of our responses. And if for some reason we missed a step, just wait till we fix it before we go on to the next step.
Okay, can
Okay?
do.
Awesome. Thanks so much for your help.
Okay, whenever you're ready there, John.
Okay. There's provider 1, patient position optimized.
It is optimized.
Nasal prongs at 15 liters and
are.
NRB or BVM plus minus PEEP valve.
Yeah, the NRB is there at 15 liters a minute.
Okay. O2, 2 sources on, sufficient amount.
They are correct.
Monitor on.
Monitor is on.
Vital signs assessed.
They have been assessed.
Drugs, IV functional.
Okay, so
It is functional.
yeah.
Okay. Pre-treatment, fluids, vasopressors, bicarb, atropine.
Yeah, so those pre-treatments are not applicable in this case. Patient's not acidotic.
Okay. RSIP drugs, doses selected, contraindications discussed.
Right, so we're going to use ketamine in this patient, 1.5 milligram per kilogram. He's 70 kilos, so that's going to be 105 milligrams of ketamine.
105 milligrams.
And he's got no contraindications to succinylcholine. His potassium was normal, predicted normal airway.
Right.
And so we're going to use the same dose, 1.5 per kilo, milligram per kilo of succinylcholine, which is 105 milligrams
Excellent.
of succinylcholine, and it's ready to go.
Okay, that sounds good.
Okay. Equipment, PPE, gloves, mask, goggles.
I have one.
BVM plus minus PEEP valve.
It's right here.
OPA plus minus NPA.
Yep, both are in.
Suction tested.
Suction has been tested.
Laryngoscope tested plus minus CMAC on.
Yeah, so they've both been tested, both blades, and if we had the CMAC, it would be on as well.
Okay. ET tube size, cuff tested, syringe on, lubed, bougie, plus or minus stylet.
Yes, James did that.
Okay. Backup airways, LMA, King LT, Crate kit.
LMA is here. Craig Kit is just done by James, and I've talked to him about that.
End tidal CO2 initialized working.
Yeah, James got that going.
ETT holder.
ETT holders here.
Plan, sources of difficulty discussed, anatomic or physiologic.
Okay, he has no anatomic and he has no physiologic difficulties as predicted by assessment.
Okay. Assistant 1 briefed re ELM suction bougie removal.
Yeah, so James is going to be assistant 1, so he's actually going to hold ELM. He's also been briefed on the other things.
Assistant 2 briefed re spinal motion restriction, collar open.
Okay, we do not need that because he's not doesn't need SMR.
Assign someone to call out saturations and thresholds for SpO2.
Okay, James is going to do that as well.
Okay. Verbalize algorithm and plan A, B, C plus failed airway plan.
Okay, he's an easy algorithm, just so everybody's aware. A is going to be direct laryngoscopy. B backup is going to be our blade change. We also have our bougie here. Position is optimized, and then ultimately we have our LMA that's going to be as a backup in case we have a failure with the actual intubation, and worst case scenario we have our Crico.
Post-intubation management discussed, sedation, analgesia.
Yeah, I've got some drugs drawn up, Scott. So my plan is providing hemodynamics are good. We'll be using ketamine 1 milligram per kilo, so 70 milligrams.
Okay.
And I also have rocuronium drawing up what we needed. That would be 1 milligram per kilogram, 70 milligrams as well.
Okay.
And then I also have fentanyl, which would be 1 mic per kilo, which would be 70 mics, providing hemodynamics. So we've got a good gamut of drugs.
Excellent. Okay, sounds like we're good to go then.
Questions or concerns before proceeding?
James, do you have any questions?
No questions,
Bruce, questions, concerns?
No, the only thing I didn't hear was the SpO2 threshold that we're going to
Good.
pull out.
Okay, great. So the SpO2 threshold, so he's 99 right now.
Okay.
As soon as we get to 93, 94, we're going to look at potentially stopping our attempt. We're going to re-oxygenate him, get his sats back up, and then we're going to do our second attempt.
Perfect.
Everybody comfortable?
That's great.
Excellent.
Good catch.
Okay, so hey Scotty, it sounds like this guy does need to be intubated. I'll go ahead and get my stuff ready if you're good to get your stuff ready.
Yeah, for sure. I'll
Okay.
get everything ready
Just
here.
gonna
to
drop
be
some
integrated.
drugs.
Yeah, you bet. Let's get the monitor on, get that end tidal warming up. Love to get that at some point.
So Scotty, I'm done my drugs. Are you good? I'll just quickly work through that checklist that we're supposed to do. Is that okay with you?
Yeah, that sounds good. I'm just getting everything else ready here.
Yeah, patient position. Yeah, that looks good. These are phones. Yeah, it looks like you got that on. 2 sources. Should put on monitors on. Vital signs, sure, that looks good. Heavy function, yeah, that looks looking good. Treatments, I don't need that. Some drugs, we got that. DP, I got gloves on. BBM, plus or minus PEEP valve. Yeah, it looks like that's on over there. Suction tested. Yeah, it looks like it's on, it's working. Laryngoscope tested, no, I see you just did that. ET2 cuff size tested. Yeah, it looks like you got the tube out. I'm sure that's good enough. Backup airways, LMA. Yeah, that's out. Untitled CO2's good. ET2 holder, yeah. Source difficulty, yeah, he looks pretty good. Intubate. ELM suction bougie remover, yeah, I can do that. Spinal motion restrictions, it is going to have a collar. Send someone to call out SATs, thresholds, SpO2, I can do that. Plan A, B, and C. failed airway plan. I guess we'll just use an LMA. And post-intubation management, yeah, we can just give him some fentanyl. We're good, Scott. I think we're good.
Yeah, just hold on a sec here, I'm not quite ready yet.
Okay, checklist is good though.
Okay, what are you using for drugs?
Oh yeah.
I didn't hear that, sorry.
Oh, okay. Sorry, I thought we talked about that. Yeah, so I'm just going to use some ketamine. I don't know, a milligram and a half per kilo, and sucks a milligram and a half per kilo. You good with that?
Ketamine at 1.5 and sucks at 1.5.
Yeah.
Okay.
Good with that?
And so what is his weight?
He's about 70 kilos.
Okay, so that's 70 milligrams of
Yeah.
both.
Okay. 70 milligrams of both?
Yeah.
I was going to use a milligram and a half.
Also 105.
Yeah.
Okay,
I think
perfect.
That's about right.
Yeah, yeah.
That's
Did
enough.
you get the title warmed up?
Oh, no, I didn't do that. So
Yeah.
I thought you had done that.
No, I didn't. Yeah, I've been a little bit busy here.
Oh, okay.
Did you mind doing that?
Sure.
Okay, I think I've got everything else ready to go here. Now, sorry, you said you went through the checklist, Kate.
Yeah, it's all done.
What do you have for drugs for after? Sorry, I didn't hear that.
Oh, yeah, I guess well, I've got some ketamine left over. We can just use that.
Okay, you know what? Maybe we should go through that again because I want to make sure I have everything. Can we go through the checklist there again? Just because I didn't hear some of the stuff that you did, and I'm not sure we had. Did you get a BVM?
So, Scotty, it sounds like this guy needs to be intubated. Do you guys do you have that checklist on you?
Oh yeah, I got that in my.
Yeah, we'll just go through that. I guess just kind of go through it as we go. Hey.
Yeah. Do you mind calling it out? Because I got
Yeah.
a lot of stuff I'm gonna have to do.
So, patient position optimized.
Okay, hold on a second. No C-spine precautions, right?
No C-spine precautions.
Okay.
Nasal prongs at 15 liters.
Okay, hold on. I just got to open my bag.
Oh, okay.
I'll get that.
Sure.
Prongs out. I may have to have you hand some of this stuff to you. Just
Okay,
do it,
sure.
But I'll do the prongs. Okay, hold on.
Okay.
That's on to you. Okay, what's next?
It says NRB or BVM plus or minus PEEP valve.
Okay, his sats are 99, so we don't need the PEEP valve, so we got that NRB on it. 15,
Okay,
so
great. O2, 2 sources on, sufficient amount.
Yeah, both are on, and both have a sufficient amount. They're all the way.
Monitor on. Can you just turn the monitor on there?
Yeah, got her.
Great. Vital signs assessed. Oh, yeah, so his blood pressure is okay. He's a bit tachycardic, but I think he's okay. He's not.
Sats were 99
Yeah.
too. Okay, so they're good.
Okay, we've assessed that. IV functional. Oh, let me just make sure. Oh, it's not. Oh, just.
Right here.
Okay, I'll just make sure it's working there.
Dripping?
Yeah, I think it's okay.
Okay, good.
That looks pretty good. Pre-treatment fluids, vasopressors, bicarb, atropine. Ooh, what do you think we should do there?
Yeah, I don't think we need bicarb. Atropine, he's not bradycardic, and he's a tox, but I don't think we need bicarb, right?
I
He's
think we're
not
good, eh?
acidotic. Yeah, I think we're good that.
Okay. RSIP drugs, doses selected, contraindications.
Can you draw those up?
Sure. Why don't I draw that up?
Yeah, so I think just probably our normal, hey, ketamine, rock, sucks,
Okay.
fentanyl, midaz. No, we
Sure.
don't need midaz. We're gonna need ketamine for post, and then what about ephedrine too, just in case?
Sure. Geez,
Okay, so
I should
you
have
do
drawn
that.
this up on the way out, eh?
Yeah, you know what? So what, here, hold on. I'll continue on here because it's gonna take you a little bit.
Okay.
Where were you? Okay, RSIP drugs. Okay, PPE. Okay, I'll get that. Are you okay if I continue on with this?
Yeah.
Can you hear me or?
Yeah, I think so. I mean,
Okay.
yeah.